Hey guys, just bear with me here. I'm just trying to get this to go. Hey guys, on LinkedIn, Facebook, YouTube, Twitch, Dailymotion, thanks for tuning in. I'm just trying to get our Instagram to kind of work. Yeah, I think we're good. Awesome. Okay, so hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with the dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and today we're joined by Dr Nader Sistan. Recent graduate of 2019 from Latrobe University, practicing in regional area West Gippsland, Warragul, with a professional interest in oral surgery and cosmetic dentistry. He grew up in a dental family with the father being a dental profession, managing his own practice. Dr. Nader Sistan, welcome to the show. Dr. Nader Sistan, welcome to the show. Bear with us, guys. We're just kind of getting him back on right now. Hey, mate.
Hi again.
So, you have a growing interest in oral surgery and cosmetic dentistry. Tell us about your CPD or dental journey so far.
Oh, well, as you know, I graduated very recently. So with the COVID pandemic, CPD courses are pretty much limited. But in terms of oral surgery, I have done few courses while I was doing dental school. So that was something that it was very interesting to do, especially back in university. You don't really get taught how to do surgicals, so that was something that I invested on more. And cosmetic wise, I spent more time on doing the basics, occlusion mainly, and hands-on. That was very, very important to me to get the basics. So yeah, so overall, it's an up and down journey with the CPD courses. Sometimes you just get into a CPD course that, okay, I expected something different from this course, but you don't get that outcome. But sometimes you just, I learned so much. But the main important lesson is just to actually use the knowledge. It's very important to do that. If you just go to CPD courses and never use them, it's just a waste of money.
Yeah, so let's backtrack for a second. You talked about you're doing some surgical courses when you're in undergraduate CPD. Tell us about that.
Yeah. So, well, most of the courses that I did was on a theoretical basis, and I had one CPD course that it was a hands-on back in, I think it was in 2019. Yeah, so that was really good. The main focus was how to raise flaps using high-speed burrs and bone removal many type of incisions and also suturing, which is very important. I think during dental school or even when you graduate is something doing suturing. It can be sometimes tricky, and you're not fast enough at it. But that was really good.
Hmm. Was there a reason why you were picked this particular CPD to do?
Look, I was I don't know, like throughout my life, I was really exposed to surgical procedures, especially from my father's side, who was a dentist and is retired now, but uh, he did quite a bit of surgeries, and then I started doing dental assisting casually, and I was very fortunate that most of the dentists that I worked with, they were really skilled with the surgical uh, routines. So that's something that I grew a lot of interest in.
Right. Okay. So you're saying that because your dad was doing a lot of surgery, oral surgery. You're assisting a lot of dentists that were doing a lot of surgeries, and that's what kind of
That's
drew
right.
your attention. Being like, okay, I want to learn a little bit more about it, and school's not quite teaching it to me, so I want to go and a 10-day CPD on it and learn a little bit more, whether it be a
That's
theoretical side.
that's right. That's right. Because look, at the end of the day, schools, they just uh, teach you basics and some and the things that you need to know as a healthcare professional, and then at the end of the day, you have specialists that do that. And I did not want to necessarily get into the first stages of my career and not be able to do or extract teeth that are sometimes tough. Look, it, at some point you will have a tooth that it gives you a bit of a like, like a kick, and but you spend more time on it. But at the end of the day, if you remove it, it's a good feeling. It's a good feeling you have to have.
Yeah, no, fair enough.
Yeah.
And so you said for your cosmetic dentistry side of things, how you're approaching that.
Look, the best approach, like many dentists say, look, learn the basics of dentistry first. Make sure to perfect that bonding, um, all sort of materials that you may use in future. And I do agree with that. It's something that you have to know them really well before you just jumping and doing cosmetics. And the first thing that most of my mentors they they told me is that just to know occlusion. Occlusion is the main thing, because no matter how much cosmetic you do, how good looking they are, if they're not functional and they're going to chip in 6 months, there is no point. So I spend most of my time, especially I had friends or I went through CPDs regarding occlusion, um, about functional occlusions, full dental rehabs, and what to consider in terms of planning. Treatment planning is very important. So I did most of that. And photography, we did have a course uh, with inside graduate program at Pacific Smalls regarding photography and intraoral, extraoral photography skills, and that came in really handy. And they've done an amazing job to teach us how to do that. So uh, I've been, I use those, and obviously it's not an end point, or you always have to keep on studying and seeking for more knowledge, obviously.
Mm. And how did you decide that you were going to pick these particular ones? Was it because, as I heard, you work for a corporate, and is it because of the corporate graduate program that's how you came across these courses?
Uh, Pacific Small Dental Group, yeah, it's a corporate, and they they were really supportive of like introducing CPD courses to especially newly graduates. And yes, look, it's something that I was always interested in, because I had that artistic kind of motivation. I always liked drawing. I always liked the aesthetic side of dentistry as well. And the fact that you just make over someone's smile and they can smile more confidently, it's such a beautiful thing to watch. And they just walk out more confident out in society. That's something that I always wanted to do. Yeah, and Pacific Smiles, they did provide us with CPD courses regarding cosmetic procedures, and especially veneers, direct, indirect veneers. So, and they always supported that. So that was a good opportunity.
And did this particular program have a structure to it, or was it kind of like you pick and choose the programs, the CPD courses you wanted to attend?
Look, there is the inside graduate program for Pacific Smiles, it's very structured. They do provide you a mentor, and that you can actually go and discuss cases with them and ask them tips and questions that you always wonder how to do something differently. And they at the end of the day, they give you a freedom of choice. Obviously, if it's not something that you're not interested to do, then there is no need you to do it. Honestly, because you're not gonna do it at the highest perfection. So, but the general idea is that okay, we need to train dentists at the highest level, and so they're able to do most dentistry in-house and provide good treatment outcome to the patients. And the structure was based on that. So yeah, we had mentors to check up on our work, our diagnosis, our cases, and we sit down and just talk through that with them.
Right, so you get the opportunity to have the mentor that works side by side with you to talk through cases and implement the CPD that you've already started to learn. Is that what you're saying?
Oh yes, and the mentors are really generous with actually introducing you to different CPD courses as well. So if you have any questions, you go to them, and if you're interested to learn more, and they are generous to tell you, okay, I've done this CPD course and it was really helpful. Regarding how you approach these sort of circumstances, or like the cases that you want to do, I advise you to do that so you learn more and you follow up with that CPD course, and you ultimately you are a better dentist, because there is someone out there to tell you, okay, you can actually use this pathway to get to where you want to go.
Yeah, fair enough. So, of all these CPDs, what's had the biggest clinical impact on your dentistry today?
It's a hard one to answer. Look, all the CPD courses are really good. Okay, it depends on what level of diagnosis and treatment you're doing. The most impact, the one that had a most impact in my career was obviously the surgical ones, because at the end of the day, I was able to achieve the outcome that I always wanted to, even though sometimes it takes quite a bit of time to get through a surgical for, and then you go, okay, I wonder why I spent so much time on this, but yeah, so that was the most impactful course that I've done, the surgical courses. But the thing is, cannot never stop with learning. So, and there's always something to learn from everyone, every dentist. So I always continue to go to them.
So you mentioned, you could pick and choose some of the CPD that you attend in the program, but was there a particular CPD that you feel like you did not implement or was not as beneficial for you at the time and you'll do differently next time?
So one thing that I didn't really quite understand, didn't grasp the idea of is just that maybe sleep apnea. Something that I was, especially with the mouth guard, I was a bit okay. I don't know. You obviously you're diagnosed. You can say this is the differential diagnosis that you have sleep apnea, or like the secondary things on your teeth that actually may show that you have sleep apnea. But I'd rather you go to an ENT to completely diagnose that rather than me giving you splints and that I'm not sure whether it's going to work or not. Sometimes it makes things worse, especially like with clenching and grinding, because the answer to clenching and grinding is not always splints, as you know. So that was something that I was just like, okay, maybe I should do more research before I just use the CPD course regarding splints and mouth guards.
So, who's been your biggest influence or mentor or idols in your career path so far, and why?
Well, the most influential person in my life was my father. From the time I remember, I always wanted to become a dentist. And because I spent so much time in his clinic as a kid, in his office, and I would just like oversee what he's doing and how he interacts with patients, and it was such a beautiful thing to watch, and it was interesting. Genuinely, I was as a kid interested, and like so many people were like surprised because I was just so artistic, and I just like art was my main thing to go to. And then really, you want to become a healthcare professional, you become a dentist, and just like, yeah, why not? And even my dad was surprised. So, but yeah, he was the most influential person in my life. And second to that, my grandfather. With most of, I got most of the disciplines in terms of studying and keeping a hard work from my grandfather, because he was in the military, and just he spent so much time in the military, and just like that military discipline just helped me to go through dental school, maybe, I don't know.
So you mean like the mindset of this, you got to do things in a particular structure, was what you took away from your grandfather, and from your dad it was just that every day of watching him being passionate about his dentistry and learning from it and watching how he was passionate. That was infectious, and that's how it kind of grew on you.
Oh, 100%. It's just I think it has its downsides because I became someone who's really a perfectionist and wants to do things like you in a very like strategic way, or in an organized way, especially at work. But that helped me along the way with studying and with actually keeping up with dentistry, especially with the courses and the university and our work as well. So that was something that I got from my grandfather. From my dad, it was just that level of compassion towards the patients that he applied in his work. And he cared the most about his patients, and he spent so much time and effort in to get people like as fit as possible in a oral health wise, and that was very inspirational for me.
Right. So I mean, A lot of people whose parents have been dentists or have people who are related to dentistry always, in their first few years, look to call them up, being like, hey, Dad, I've got a tough case. Do you find that's the case in your case?
Oh, yeah, 100%. 100%. Sometimes I'll find myself talking to my father for hours regarding like a case. And meanwhile, my mother is sitting just next to us and just she goes, okay, can we stop talking about dentistry? This is too much. Yeah, I always do that. It's just something like it's a bonding moment with your father too. You know, you just talk about things that we both pretty much our profession is based on. So yeah, it is a funny thing because sometimes we get into arguments that I want to do it this way, and my father would go, no, this is the way that I would do it, and we just come up with excuses or like things that, oh yeah, maybe this is not the way to go through this procedure. This technique is better, but yeah, I always do that.
So
he's been my mentor for most of my career anyway. So
who ends up being right?
Usually we just go, let's agree to disagree. I don't want to dump my father. No, but it's different. It's different. Like it's a generational thing too. Like some, especially like a dentist from previous generations. Obviously, they do things differently compared to the dentists who are newly graduated and they were exposed to equipment or technology that back in the day wasn't existent. So obviously they would go, okay, like you have this technology in your hand, like sure, why not? You go this way, do this procedure this way, but or better studies or like research, why not? But yeah, like I would take his most of his inputs in my career. They're useful. Because sometimes you have to go all back to the basics and the old school dentistry to get things done. Because sometimes technology fails you. So, yeah, usually I would say he wins because he has the better experience.
Okay, so are you saying that it's more you're taking away more clinical aspects, or is it more like non-clinical soft skills that you might be taking away from him when you have a discussion with him?
Look, the clinical aspects, obviously, he practiced for 30 odd years, so experience-wise, I have nothing against him. So he actually got exposed to many things that. I wouldn't dare that I say I've got exposed to. So I would take that clinical experience from him. But in terms of literatures and research-wise, obviously, new generation is a lot better because we know how to deal with technology computer-wise. So that's something that I would say. I would go with the clinical aspect, and the theory-wise, I'm better slightly, or the research-wise.
One thing people talk about as well is, as an associate, you kind of there are barriers in when you're working for a practice. But given that your dad's been a practice owner before, do you find that he can lend some out like another perspective onto it?
Like in terms of owning a practice, or the business-wise, or the clinical-wise?
Yeah, I mean, whether it be just, sometimes associates and owners don't have the same outlook. But now that you're an associate and your dad's a history of being a practice owner, do you think that he can help you explain some of the issues that you may be experiencing?
Oh, yeah, 100%. Like in terms of business wise, like you always see it as, okay, I'm gonna own a clinic maybe in one day and just gonna run it. But oh, I had that picture in back in the days when I was in uni, that okay, I'm gonna own a clinic and I'll run it, and I'm not gonna face any adversities or any problems. But then my father. Well, he has explained many things regarding business wise, how difficult it is to run a clinic, how difficult it is to manage a balance between a clinical life and a business life, because at the end of the day, it is a business. But how ethical and clinical oriented you have to be when you're dealing with patients. That's very important too. And clinical wise, yes, it is. It is a different lifestyle. Like I don't think I'm ready yet to own a 100% full clinic
Yeah.
under my name. But yeah, so yeah, definitely.
Yeah, well, I mean, like, where I'm coming from is a lot of our community obviously are sometimes at that point where they're deciding between, taking their career to the next level, and they're thinking, it should be okay to kind of go to and buy a practice. It should be, there might be some struggles, but, it shouldn't be too hard. And so for someone like yourself, who's got that ear at home and can give you advice, straight away, that's where I was coming from. Yeah.
Yeah, look, it going to buy a clinic, yes, but like the thing is, you never can share a stress level with someone else. So owning a clinic is very stressful. And you always have to be on your toes and just make sure that everything's running smoothly as possible. Because at the end of the day, you're the boss, and everyone has to work like a clock, and to make sure everything goes smoothly. And not mentioning that you have to make sure that clinic feels like home to every person who works there. They have some certain level of compassion towards the clinic. So that's very important. But going and buying a clinic and starting it from zero, um, it requires some level of skills, and like professional skills and also clinical skills that I don't think not many new graduates would show that from the beginning. They have to attain that throughout their career, and then they're ready. But the average, you know, the experience that people would go and buy a clinic is within the first 5 years. I think that that's something that is doable, but still there's a lot of stress level. Yeah, yeah.
Fair enough. So, have there been any particular struggles in your dental or CPD journey so far that some of our viewers might not know about?
Well, I think everyone knows this is pandemic. Yeah, the struggles is just I'm more on a hands-on learner. Like I like to learn and experience things and do things with my hands and just understand the technique rather than just listening and go through lectures. Look, lectures are good. Theory side is good, but at the end of the day, you're applying that knowledge on your patients. And if you don't have the dexterity or hands-on skill, I don't think that would be that's a good outcome at the end of the day, because it's something that you have to work on a lot. But my struggle has been to find a good CPD course to actually have a good balance between the theoretical side and the hands-on side of things.
So, what does your current ideal clinical day look like? The type of procedures you might be getting up to.
I would say all checkup and cleaned. No, I'm joking.
It's
It's a lot
okay if it
easier
is.
to. No, look. I like the mixture of things. Look, at the end of the day, you don't want to do one thing over and over again. That's why I like general dentistry, because you are able to do many things, go through every discipline, like endodontics, restoratives, like oral surgery. So, um, my ideal day would be maybe restoratives, checkup and cleans, and maybe one or two extractions a day. But the best ideal day is just when I get through the patients, when I get through my job, uh, and get out of the clinic. I'm happy that I've done the best I could have on the day. So that's the best day for me. That I sit in my car, I just get home. That okay, I've made the right decisions.
Mm.
You know, like in dentistry, you just sit home and just think about that one patient that you thought you're gonna do the best, and then you go, oh, I should have done this, I should have done that, and you just stay in that loophole.
Yeah, yeah, no, understandable. Hey, like, when you're a dentist, you're usually a particular type of person, and when it comes to trying to get things, we say it's all about those millimeters. It's all about making sure we get those small things right, and so sometimes we can get very caught up in those things, and so it kind of you kind of beat yourself down, and then I understand where you're coming from. Ideal, you want it just to run smoothly.
Yeah, honestly, like yeah, running smoothly is the priority, pretty much. Like you want to get there, you want to see the patients, you want to make sure that they're happy and you're happy when you're finishing the job. Okay, obviously, you know, in dentistry, nothing goes according to plan. There's always something that goes wrong. But as long as you are able to manage it, and it's not something that you would come home and think, okay, like what happened today, why things gone wrong, and you just stay in that loophole, overthinking about stuff. I'm happy to not have that any day. But one thing I've learned is that it's okay to have the days that you don't feel enough, you don't feel that you've done your best, because not every day is perfect. Not every day is perfect. So uh, you fall and you get up, you keep going.
That's some wise words there. So, share with us what you hope your ideal clinical or non-clinical day might look like in 5 years' time, and what CPDs might you want to do to kind of get to that point.
Well, I would I would prefer to get my hands on implantology and being able to place implants in the next 5 years. Is something that one of the things that I always keen about with dental surgery is to get the basics right in dental surgery as well. So when I get to do implants, I have that knowledge. Yeah, so in 5 years, clinical days would be, yeah, I would be able to place implants, and that's something that would add on to my scope of practice. Non-clinical clinical days, sunny weather, uh, maybe maybe a good restaurant in front of a beach and enjoy my day. That's something would be nice. No lockdown.
No, that's fair enough. I know in Sydney right now it's quite wet, so naturally, yeah, we
Yeah.
would want to be out there a bit more. So you said implants is something that you want to get kind of involved in. Is there a particular implant course that you're interested in or has got your eye?
Um, with this pandemic, I haven't even looked into it because most uh, implant courses, yes, the theory side is very important, but as I said, I really want to find something that is hands-on. Okay, so it's something that they would go through cases and hands-on cases as well, to be able to place an implant, to have that mechanical control over something, and treatment planning is very important too. So these things, if I find that something, a good combination of treatment planning and a hands-on course, please let me know.
I'll be sure to overlay. I'll be sure to let Omid tell you and relay it to you. Hey.
Yeah, definitely.
For some of our viewers, Omid was you were working for a dental assistant for him at one point. Hey.
That's right. I worked for him over a year as a dental assistant, and yeah, look, he was a genuine mentor for me. Like, in terms of oral surgery, like he had a great passion about oral surgery and surgical extractions as well. So I always enjoyed working with him on doing this sort of procedures. And look, he was great. I enjoyed working with him.
His passion for oral surgery probably rubbed off on you a little bit more as well.
Yeah, so, even more. So yes.
Dr. Nader Sistan, thank you for coming on the show today. If you let the people know how they can find you and what's kind of going on in your life.
Sure. So I do have a public Instagram page, and Dr. Nader Sistan. Okay, we can drop a hint somewhere in your Instagram page maybe, and you can find me there. And I do offer online consults if people are interested. Other than that, Facebook page it's easy. You can find me on Facebook and or my email. I'm really chill to talk to people. So yeah, people can approach me and talk to me if they want to.
So, for all of our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe. For our listeners, if you like this episode, leave a review as well, but don't forget to share it with your friends, and we will see you on the next episode of CPD Junkie podcast. Thank you.
All right. Thank you for having me.